Vaccine hesitancy is a troubling term that the Health and Wellness Ministry is ascribing to persons in the high-risk age group who have not gotten vaccinated or may be reluctant to. Portfolio Minister Dr. Christopher Tufton says less than 16% of that group have taken the jab. The matter was discussed at Thursday's COVID Conversations media briefing. The Health Minister says although it's early time yet for an overall population count, there are signs of hesitancy among the vulnerable population, with the 60 to 69 age group having just under 16% take-up, and they're not the only ones.
70 to 79, 22.6, and over 80, just under 18% take-up. Now, I'm not prepared yet to say, and we're not prepared yet to say that it's purely about hesitancy, because I think there is a need to ensure that there is equitable access by all the socioeconomic groups across the population. And I do believe that what the blitz that we had demonstrated with the involvement of our elected officials or members of parliament, councils, and so on, is that their efforts and the mobilization to take people out of communities who otherwise may not have had either the means or the inclination, so they had to be convinced, that contribution made a difference in terms of persons coming out and persons coming out representing all the socioeconomic groups.
He says the ministry is looking at inequitable distribution of the COVID-19 vaccine as a factor for the unsatisfactory turnout.
There's going to have to be a strategy to ensure that when we declare hesitancy, it is based on persons having the opportunity to and the means to, but are not taking up that opportunity. And then we know we have to now focus on the convincing side.
Dr. Tufton says people over 60 years should recognize that their age mates represent the highest number of persons who die from COVID-19 related complications.
And so it is so important for them to take advantage of the opportunity to access the vaccine. And even with the challenges of sourcing supplies, the reality is that that opportunity exists now and has existed for some time.
The Health and Wellness Minister says the low number of elderly persons taking the COVID-19 vaccine has influenced the decision to lower the age group to 50 and over, so as to utilize the doses now available for the most vulnerable.